Thank you so much for joining us, Julie. It's great to have you on a very important topic on our show this morning. First up, speaking of the health sector, since today is the Health Workers' Day as well, would you like to highlight USAID's work to respond to the COVID outbreak?
First things was to create an app for the telephone so that health workers would be able to enter information about if they encountered a patient with COVID in order to share that information and to understand where the incidence of the disease is. Now that's really important. Any kind of illness, it's important to understand where it is and be able to share that information in order to track it. So that was one of the first things. One of the other things was bringing in hundreds of ventilators from the United States. We work with the Pakistan government to identify hospitals around the country and then to train the medical workers on the correct way to use those ventilators to be able to save the lives of COVID patients. We also created, in conjunction with district governments in every district of the country, every province, every district, an operations center for being able to track and trace the COVID epidemic. So to be able to, again, to pull the information together, to know where the incidence is and be able to get treatment and get resources to those districts. The last thing I want to mention is really important. The United States is the #1 contributor to the COVAX facility. The COVAX facility is an international effort to bring equity in the distribution of COVID vaccines around the world. The United States has already contributed $2 billion to the COVAX facility and will be contributing another $2 million. Pakistan is one of the countries that is scheduled to receive vaccines through this facility.
Although, Julie, third world countries, developing countries have serious reservations regarding the COVAX and its role in the distribution of the vaccines, but you have mentioned quite a few list of things जो कि अमेरिका के ताउन से USAID के तहत पाकिस्तान में की गई कोरोना वायरस के दौरान
जिस पे वो ट्रेनिंग भी दी गई,
वेंटिलेटर्स भी मंगवाए गए, but certainly we would really like to ask you that what else do you plan to do or what else are you already doing in the health sector and health related topics in Pakistan?
We've worked for years with lady health workers to have them be able to provide very high quality services. We've also brought in high quality and very inexpensive life-saving drugs to save not only new mothers, but newborn babies. And the results of that work in Pakistan has been a dramatic decrease, both in maternal mortality and in infant mortality. It's a wonderful achievement. But there are other things that are health-related that aren't necessarily in the medical field. For example, air pollution in Pakistan today is creating illnesses in children and adults alike, and it's even reducing their life expectancy. So this is a hugely important issue. We've worked with the Pakistan authorities on trying to increase clean, green energy to reduce the air pollution in the country. That's meant dams to create hydroelectric power. And in Sindh province, it was a huge wind project to create wind energy. Another part about health that often isn't connected is the importance of girls' education. We know now from decades of experience that families are healthier when the woman in the family has been educated. So that means that their children and their families eat more nutritious meals, and it also means that the mother ensures that her children and the rest of the family receive proper medical care. So that's my plug also, my endorsement for girls to continue their education because they will grow up one day and be wonderful mothers and ensure the health of their families.
Thank you so much, Julie.
Thank you.
और बहुत से यही हम जूली से भी बात कर रहे थे जो कि बाय द वे मिशन डायरेक्टर हैं USAID, और इनका कहना था जो टॉपिक्स इन्होंने किए हैं, तो गर्ल्स एजुकेशन, क्योंकि जितना भी इस पे कंसंट्रेशन किया जाए, जितना भी काम किया जाए, वो कम ही लगता है, बिकॉज अ लॉट नीड्स टू बी डन. तो ये गर्ल्स एजुकेशन पे बहुत कम है. फिर विंड एनर्जी को क्रिएट करना, मतलब कितने एवेन्यूज़ हैं, कितने डिफरेंट एवेन्यूज़ हैं जिसमें मदद दरकार है और मदद मिल भी रही है. सो दीज आर सम ऑफ द थिंग्स दैट USAID इज वर्किंग ऑन.
शुरू से ही मुख्तलिफ तरीके से पाकिस्तान में लोगों की और सरकारी सतह पर मदद कर रहा है.